Bonjour, my name is Jennifer Bully. I work here at the Red Cliff Community Health Center, but I also consider myself a community member. I'm actually a member of the Bad River Band of Lake Superior, Ojibwe, but I've grown up and worked and played in Red Cliff for so many years. I just love this people, and I feel like I've been accepted as a community member here. As we're standing outside the Red Cliff Community Health Center, it's just very striking because the facility is so gorgeous. It's so beautiful, and it almost brings tears to my eyes because I think about all the hard work and planning that went on to create this space for our community. And it's really just a testament to the type of care that our community deserves around anything, medical, dental, looking at physical therapy, behavioral health, all of those components of what helps to make a community healthy. But I think the forethought that went into planning this facility was just so amazing, from tribal council to clinic administration, especially Patty Derrigan Navarro and Diane Erickson. All of the teachings and input that came from our elders and the community and our families, it's all a piece of this, and our community owns every brick, every stepping stone, every piece of this property. It's really theirs. And we look at the stone facade and and the natural wood, and how it's just really highlighting the natural beauty of this area. And I just really love the Ojibwe floral design that goes around and kind of wraps around the building and wraps it in those teachings. That's what it was designed to do, really wrap this facility and the community and our Anishinaabe heritage and who we are as Anishinaabe people. And all the way down to the plants that are outside, the indigenous plants, and that they represent medicine. And that is so very, very important. I do receive my medical care here, and I really appreciate the ability to have something so beautiful, so close to home, and then also know that the people here really care about who I am as a person, as a community member, not just because I'm an employee, but because that's their job and that's what they do. They really do care about the individuals that walk through this door. Here we are in the registration center. This is really the first thing that patients see and families see as they walk through the doors of the Red Cliff Community Health Center. It's really very beautiful, the atrium, the way that the sun comes through, and I think that was all really an important design element for those that were designing and implementing all of the structural, architectural nuances of this facility. One of the coolest things I think when I look at this building is the really beautiful glass window that has the Red Cliff Band of Lake Superior Chippewa, hub of the Chippewa Nation's tribal seal. And it has all of the clans represented. And I just feel like that really gives some grounding in space to who this is and who we are here to serve. So there's so many beautiful elements with the tile mosaic that's here on the floor, with the turtle and the walleye that are swimming around. The turtle, interestingly enough, in the clan system, or the fish clan, are some of the visionaries and the philosophers and the storytellers. Those are some of their traits within that clan structure. If we're going right into the patient lobby, you can see there's also this really lovely display case that is representative, in my mind and from what I know, the four hills of life, sectioned off into four segments. And we have that first hill that represents new life, birth through young childhood, and then we have the second section, which represents all of adolescence, and then we have the third hill, which is the representative of the adult time in life, and then the last hill, which is the elders and the end of life, which completes that cycle. And it's really just beautiful, and I think it really speaks to the philosophy of administration, of the tribal council, of the community, and that we would really want to be able to provide full circle of life care throughout the spectrum. So if you're walking into the lobby was really thoughtfully planned to be comfortable for families that are here receiving care. It has a fireplace, a beautiful atrium, again, lots of natural light and sun. And there's lots of really beautiful design elements with the pussy willows and the natural wood. And I just think that's just so beautiful, again, highlighting the natural beauty of this area and also of the people. When we step onto the care floor where patients or families come to receive care, this has been really thoughtfully designed, again, around the Four Hills of Life philosophy. When you first step onto the care floor, it's the adult or elder section, and that's the team that specializes in that. We have photographs from community members that represent that time in life. So with that elder and adult, later adult years is represented by winter. You know, we kind of get asked every now and then, why did you start with winter? Why did you start at the end? And one of the things that we had decided as a team, but also the administrative team, both Patty Derrigan-Navarro and Diane Erickson, really felt adamant about, and the whole staff agreed, is that this is where we serve our elders the most. And we want to give them the first seat at the table of wellness, so to speak. So when they come in to get their care, they're not walking a long ways, because we know that some of our elders have mobility issues, and we want to be sensitive to that and be able to make sure that they were given the honor to be able to access their care in a real way. And as we move down the hallway, we get into fall, which is adult care, and then we also have women's health. But again, some really beautiful images of this area and what fall time looks like here. I think it's just really beautiful. We move a little further down, we see summer, and again, those community members who have, from their perspective, what summer looks like in Red Cliff. And so we get to spring, and that's pediatrics and also new babies. So we have the pediatric care floor, and we have the community health floor, which deals a lot with that first hill of life, the services surrounding that. Our Zikitchagazwin home visiting program, our WIC program, and other types of community health care. Every care floor, and actually everywhere a patient is intended to walk, there is a beautiful floral pattern on the floorway, or on the floor. And it's representative of the Ojibwe traditions, our 7 teachings, and all of the sacredness of who we are as Anishinaabe, and that everywhere families walk in this clinic, they are walking on those teachings that is being guided to them to get to the care that they are looking to seek. So we're in the Bowajage Nagwagan room, which is the dream catcher room. And this is a room that was built specifically for group model of care. We have a model of care around centering, but this is a circular room, and it's meant to hold a community of people that are experiencing similar issues in their life, whether it be around parenting, well child care, diabetes, heart disease, weight loss, all of those things. It's a place and a meeting space specifically set aside for community members to come in and get guidance from one another, have support, and then also get support from community health and primary care staff. It is really that link between primary care and community health that is so needed when we're trying to provide comprehensive services. This is also one of the spaces that staff use to be able to smudge. Our program, the Zikitchagazwin Home Visiting Program, uses it to smudge every Monday morning to open up the week with a really good week and a good heart and a clear mind, and leave the weekend in the past and get ready for some productivity. And then it's also how we close our week out with a Friday afternoon smudge, just to process and debrief of the week's happenings, and then also to let go of work so that we can enjoy our weekends with our family and our friends and our community, because it's really important that we practice good self-care so that we can continue to do the important jobs that we have and really be able to partner in a good way with our community members and our families who we work for. So here we are on the back side of the care floor. This is where the providers are, and we have an open concept, so everything is connected, from adult care to clinic management to women's health, pediatrics, and then our program, which is home visiting. Again, that real link between primary care, community health, and we also have this link with early education. And that's a really great way for a community to be family-centered and looking at all of the needs of the clients and the families we serve. You'll see that we took some dry erase markers, and on the windows that pass by we listed all of the different clans. And so the Muckwa, or the bear, or the clan that has been selected by the health center to represent. And the reason being is that the bear clan are the ones who traditionally patrolled the village, and they became intimately knowledgeable about the medicinal plants in the area. And so in that way, they're one of the keepers of the medicine. And so the health center really felt like that was important. And you'll see it on our logo and our brand, the bear in the middle of the circle, and the bear being there as the caretaker of that medicine and the protector of the health. From what I've been told and the teachings I've been given is that no one clan or one person can do everything. We all have to work together. And that Anishinaabe, before the clan systems, were not as cohesive. There was more fighting about who was going to be in charge, who was going to be the leader, who was going to do what. And when Creator gave those clan systems, it formed a organizational structure to look at the community and keep the community moving and getting everything that needed to be done within the year. And so that's what I've been taught. And I think that's really important, because in a work setting like this, and as a community member, you know that you have people who have all different skill sets, and that they're all equally important, and they're all so valuable, and that we're all working together to do the best job that we can for each patient, each client, each family member that comes through the doors.